Dr. Dinesh, moderator for the guest lecture on telehealth and remote lactation by the speaker, Dr. Navin Jain.
It gives me great pleasure to invite and introduce Dr. Navin Jain, who has been a great friend. I think most of you know him. For those who know, he's a neonatologist, very popular in the country, but he comes from down Kerala, South Trivandrum, from KIMS. He's the editor of the popular book Clohati and also Illingworth, and has been awarded as the best teacher by National Board of Examination. So remote monitoring is something all of us become sort of quite popular now, especially from the ICUs. We're looking at more of tele-ICUs and other things. But how it helps in lactation support is something is going to be very interesting to hear from you. Over to you, Dr. Navin.
So what I'm going to present is somehow incidentally something that was given to me as a topic which we are trying to live for the last 1 year and trying to see how we can actually bring telehealth into what is called as positive health. Currently our country still lives on people coming for fever, cough. There is a need to go to what is called as positive health now. You don't want mothers to come for lactation assistance or help after they have developed a problem. The greatest challenge we found is that by the time mothers go home from large hospitals, whether it's public health or private, they go to homes which may be 50, 100 kilometers away, or in Hyderabad or Bangalore like city, even 20 kilometers away will take half an hour to reach there. So imagine, thank you. This is the message we keep giving to babies and mothers who are in the hospital immediately after delivery. We tell them avoid visitors, you are vulnerable to infection, and your body immunity is low, baby should not be disturbed. If mother is not disturbed, lactation will happen, and so on. This is what the key message we keep giving when we are having babies born in the hospital. Dinesh might remember this, Srini might remember this, in Rachna might. When we had to book railway tickets once upon a time, it used to be a celebration, a festival. We had to go 6 o'clock in the morning and stand in the queue. The queue would be there long outside the railway station even before the counter starts. Now we wouldn't tolerate any of those things. We want everything that phone pe baithe baithe. Yesterday I just messaged that I am coming and I forgot to book the room, and they booked the room in 2 seconds. So telehealth and lot of effort going in. This is the state of our postpartum visits now. Despite of trying to fast track that a postpartum mother has come for day 3, day 5, we have made it religious that all babies should come back for jaundice assessment. I think we can't change that. But imagine a mother sitting after 5th day or 4th day of her birth and sitting with the same newborn baby who you were telling that she should not be faced with infections. Now she is sitting with bronchiolitis, she is sitting with every other child, and for everyone it is an emergency. Nobody is willing to allow them to go earlier. So do mothers have to really wait to see and get what is called as positive health advices? I am not going to talk about jaundice assessment. I think still the lighting of the room will have lot of issues, so we can't do that from home. But beyond that, beyond 5th day, what do we do? The mother is already very stressed out. She is physically, emotionally drained and tired. And then on top of this, if she has to come outside your OPD and wait for another 15 to 20 hours and then go back, I don't think she'll be any better with her lactation problems. These are the kind of recent Google reviews we got. I picked up the bad ones that we got. Baby was not given milk, mother was crying all night, and the mother was also under trauma. There was exactly opposite one also. Baby was given formula, dangers were not explained. And they kept saying that first 3 days when they were crying for milk, at that time the doctors keep saying, don't do anything, milk will appear. 5th, 6th day when the baby came back with jaundice, then they say you have less milk. So they're all confused. They're very stressed out, and they're saying after admission you're charging me money also for both phototherapy as well as neonatologist visits. So Nitasha, you can't charge them money even if you admit them. So having said this background, what are the lactation issues that usually come up? There are not too many actually. You can classify them under various simple heads: feeling that milk supply is not enough, or sometimes really it is not. Breast and nipple issues, baby sleeping rhythms, and other two maybe not directly immediately, but preparing a mother for going to job. She comes to you for a lactation assistance, and we heard in a poster outside, a beautiful poster saying that If you educate the mother before delivery, then the impact will be much higher. So these are some things you can do. One of the difficulty with the lactation assistance, I'm sure there are so many lactation consultants here, and everyone else is doing lactation consultation, even if they are not trained. So what happens is we are giving inconsistent messages, and there is a need for some courses like this, some consistent message training, so that different messages don't go and mother doesn't get confused. So I face this battle every day during my rounds, because somebody who went before me said give 2 hourly feeding. Now this mother is trying to wake the baby up 2 hourly and he wouldn't wake up and she is depressed. Then I go and say give demand feeding, and my next colleague goes and says 3 to 4 hourly feeding, and one mother raised a RRT saying that come back and tell me exactly what do you want. You want me to give 2, 3, 4 hourly. So if you had a lactation consultant, then only you would know, but where do you get them from? How many are certified lactation consultants in this hall? And how many babies are there, my God? So therefore there is a case for what is called as remote consults. There can be remote consultation, can have actually real videos being shown to the mother who is wanting to know what to do, not after the problem arises. I think the greatest problem is in positive health, in letting her know. Technology can be done. Step-by-step instructions can be there. Many mothers like it that way. Show me all the steps, or they will say, I want to record what you're telling, I'll forget after going home. Audio instructions can be there. You can draw on the top, like Mangala does in his presentations, on the top of the video and say, this is exactly, turn it here. You can do by technology. And you can even show ideal videos and your video. And you can change the speed of the video. If you want to see some beautiful girl, you will slowly reduce the video speed and see. So that also you can do. So many things can be done. And today classrooms are like this, where instead of trying to imagine what is a nucleus, you don't draw anymore, because you will be bad at drawing. You have a picture like this, a smart screen, you can make it bigger, you can change color, a pointer. Why not same thing for lactation guidance? So everyone has a smartphone these days. There is nobody in this country who doesn't have one, some have 2. You have a telehealth facility after COVID, everyone has it. So there's no investment required. All you need to do, and if they're having privacy issues, they can record only the breast. They need not record the face of the person. And like I said, there are so many things you can do. I think the fonts are small, but you can do all the things I said, like playing the video again, drawing on the video, showing an ideal, showing an audio command, and things like that. Now, in next 2 minutes, what did we do? What did we experience in the last 1 year when we were trying telehealth, not knowing that Nitasha will ask me to speak on this subject? It was unbiased. So we realized that everyone has a smartphone and knows how to use it. So what we tried as a simple study is, before any baby left for home, we taught them about telehealth. We went to the room and tell them, on 10th day, you will get a mandatory telehealth. This is complimentary call. The hospital will call you, because we are sure that by the time they will have hundreds of complaints regarding, that time it was not for lactation alone, but whatever concerns, rather than them going to a smaller hospital nearby and getting 50 medications from levosalbutamol to Montelukast for a stuffy nose. That was the whole idea when we started. We didn't want them to get wrong medications. We wanted to solve their problems online. So we were trying to look at what was, and lactation happened to be the major share of problems. Understandably, it was only 5th or 7th, 10th day of life. They wanted to know about schedules, they wanted to know all this. This could be solved on the telehealth. They need not walk to the hospital, and they could again call us back the next day if they want to solve the problem. So what we were trying to push, and this is not because of this conference alone, universal telemedicine consultation for positive health should be offered to every mother who goes home. She should have an option to reach out to you, and this can be taught how to use. That's all you need. I'm done, it's over. And the intervention is that we were trying to look at how many proportion of families. In our first year effort, only 30% mothers engaged in teleconsultation in spite of offering free consultation. So we're trying to look at what are the factors which stop mothers from asking for it. So that we will come back next year and tell you. There has to be, just like you get a call from your car service and they say your voice is being recorded, we may also have to look at whether we know how to do teleconsultation correctly. Good morning, what is your problem, and not get angry about it and answer correctly. So this is the end of the presentation. Telehealth is the way forward. It is critical to assist lactation. It has to be not for troubleshooting, it has to be for positive health. To prevent problems from coming, mothers should be given a telehealth after they go home. It will help mother and baby sitting at home. They need not come and sit in our OPD. Navin Jain and Dinesh Shirla can still keep charging them for this. There is no problem with that. Phones are there everywhere. There is nobody who doesn't have a phone. No infrastructure building is required. But structured teaching will have to be taught to the person who are attending the calls so that we don't give inconsistent messages till after this. And these recorded messages can be shown to our certified lactation consultants to improve on our services later on. Thank you for your attention.
Thank you, Navin, for an excellent presentation and sort of, sharing your experience of telehealth. My question, one thing is about, we do also this WhatsApp consults and other things. How do you test the adequacy and others? Because one of the things, of course, you can educate them, you can talk to them, things like weight, jaundice. See, because once you start, everything starts, isn't it? So, do you say only you talk about lactation, or you combine with the other aspect of neonatal care also doing the telehealth?
I think jaundice should not be assessed still, because even in this room you can't assess jaundice. Forget on telehealth. But its greatest way forward is in positive health rather than trouble solving. So, if there is somebody, this is my way, I do about 4 or 5 telehealths every day. If they have a problem saying that I am having a difficulty, then I request them one thing. You go and see your pediatrician nearby, take the weight, take whatever parameter I need. Tomorrow you do a free telehealth follow-up with me. But then a physical examination is critical if you are looking at medical problem solving. So telehealth will be useful not in medical health problem. We are going to dilute medical care. It has to be for positive health in prevention of problems. I feel that way.
Education should be the main focus there.
Thank you, Dr. Navin Jain, for your insights.